I'm Dr. Stephen Davidson, the sexual integrity coach located in Wilton Manors, Florida. I'm happy to bring you another episode of Adult Sex Education. I had a message from a subscriber, Bob, who shared with me that while he has no problem ejaculating when alone, he can't ejaculate when he's with a partner. He said this is frustrating to partners who take it personally and conclude that they have failed as a lover. This issue comes up with male clients, both straight and gay, and with men in every age group. Our subscriber's situation sounds contextual. By that, I mean that it only happens when he's with a partner. It could also be considered relational if it happens with only one partner, but not all. This leads me to believe that there's nothing medically impairing his ability to ejaculate. The official diagnosis would be delayed ejaculation, specified as situational since it only occurs when with a partner. During a full clinical evaluation, we would also want to determine if the symptoms are recently acquired or lifelong, and we would want to rate the level of distress associated with the symptoms as either mild, moderate, or severe. I know it seems odd to call it delayed ejaculation if it isn't happening at all, but that is the clinical term. Casually, the word delayed is a judgment since some men and their partners enjoy the fact that it takes him a long time to reach orgasm, or even that he never achieves orgasm during intercourse or oral sex. Whether it's a curse or a gift is a matter of perception. The chances of delayed ejaculation increase in men over the age of 50, and the risk doubles in men over the age of 80 due to both physiological and psychological reasons. Delayed ejaculation is also referred to as anorgasmia or inhibited ejaculation. Since sex is both psychological and physiological as an experience, a consult with a urologist as well as a sex therapist is a good idea. Today I'm going to talk about some of the psychological and relational reasons men experience delayed ejaculation and how to manage it. Men generally associate ejaculation with orgasm. This is actually a two-part process. Orgasms originate in the brain. In order to achieve an orgasm, the brain has to release inhibitions and control. Being preoccupied with intrusive thoughts or being too vigilant or anxious can delay or inhibit an orgasm for both men and women. Other emotions can impair sexual performance as well, and I'll talk about those more in a minute. Male orgasms generally conclude with ejaculation, which is the release of semen from the penis. The brain, again, signals the reproductive organs to ejaculate semen when sufficient stimulation has been achieved to reach orgasm. This is the part 2 of the two-part process. The brain plays a very important part in our sexual functioning and our sexual fulfillment. This is why sex educators so often say that sex is an activity that happens from the neck up. Your penis really doesn't have a mind of its own, even though it might seem that it does. Being anxious or hypervigilant can also cause female orgasmic disorder or genitopelvic pain penetration disorder in women, as well as erectile disorder in men. As a sex therapist, many of the men I treat for erectile disorder are young men referred by their urologist, when no medical reason can be found for their inability to achieve an erection. They often get no benefit from PDE5 inhibitor medications commonly prescribed for treating ED. This only exacerbates their anxiety when they take the pill, and even it doesn't produce a result. Ironically, they can wake up with erections, and they can get an erection when they masturbate, but not when there is another person present with them. These pills are not psychotropic medications, so they're not marketed for the treatment of performance anxiety or any other psychological or relational factor that impairs sexual performance. Erectile dysfunction is also considered contextual or situational when it only occurs under certain specific circumstances. I refer to sexual disorders as relational when they are unique to a relationship with one person specifically, but not all relationships. In order to relax sexually with another person, we have to like them a little and trust them to some degree. If we find the other person's personality or appearance to be repulsive, we will likely have difficulty functioning sexually. In my own practice, I've observed that male victims of domestic violence sometimes present with symptoms of ED or delayed ejaculation. The physical, verbal, or emotional abuse by his male or female partner negatively affects his ability to perform sexually. As I said at the beginning of this video, anxiety isn't the only emotion that can lead to sexual dysfunction. Guilt, shame, low self-esteem, and grief can also contribute to delayed or inhibited ejaculation or erectile dysfunction. I often talk about shame in my videos because it is so pervasive as a deterrent to sexual fulfillment and emotional intimacy. Shame related to one's body or sexuality can lead to psychological trauma that, for some individuals, is so severe that it is never completely resolved. Sexual shaming that happens early in life imprints on our sexual self-image and can cause sexual dysfunctions for both men and women. Men underestimate the effects of shame on their sexual identity because culturally, men more than women get less empathy for both physical and emotional pain. Guilt can contribute to sexual dysfunctions when you believe you are engaging in sexual activity that could physically or emotionally harm another person or create consequences socially or occupationally for you or your partner. Examples include cheating with a friend's spouse, sex with a coworker, or sex with anyone else where it is essential that the sexual relationship be kept secret. Some men have low self-esteem due to body dysmorphia, social awkwardness, or lack of sexual experience. During sexual activity, they can't turn off the voices in their head that are judging them, causing them self-doubt and a loss of confidence. It can impair their ability to get or maintain an erection, as well as their ability to ejaculate with their partner. Following the breakup or death of a partner, experiencing sex with someone else can bring up sadness when it reminds you of the loss of the one you loved. This can be true even years after the separation has occurred. Some people even feel like they are cheating on their former partner, even when that relationship has been severed through death or divorce. When the brain is preoccupied with thoughts that generate emotions of fear, guilt, shame, or sadness, the brain's priority is to relieve the distress. This is part of our innate survival mechanism that is always on autopilot in the back of our mind. Before engaging in sexual pleasure, the brain automatically wants to eliminate the source of distress. And ironically, that beautiful body next to you might be perceived more as an emotional threat than an object of raw sexual desire. The primitive brain doesn't differentiate between physical or conceptual threats. The cortex of the brain, often referred to as the executive brain, wants to bring logic and reason to the problem-solving process. Men will try to think themselves into erections or ejaculation as a way to deal with the sexual dysfunction. But erections and ejaculations are not generated through executive brain functioning. Next time you're out in the world, just take a look around you for evidence that it doesn't take a lot of intellectual skill to have sex. So approaching this problem like you're trying to solve an algebra equation only adds to the frustration. Men often don't understand how their emotions affect their sexual drive and functioning. Men are neurologically less proficient than women at identifying emotions, and sadly, this is further complicated by the fact that in most cultures, men are socialized to deny or repress all emotions other than anger. Women also have some of these same beliefs about men, so when he can't sexually perform to her expectations, she might respond with judgment or accusations instead of compassion and support. Since men are socialized to deny fear, they often are unable to recognize when they are anxious. Just like women, many men think that penises should always be ready to go. They forget that their penis is an organ attached to the body that responds to both physical and emotional stimulation. They're often confused because they really wanted to have sex with the other person. They found the other person attractive. and it doesn't make sense to them that they can have anxiety about something that they also desire. Remember what I said earlier, sex happens from the neck up. Everything going on in the big head will also influence everything happening in the little head as well. So why do we stress out about this instead of simply accepting the reality and addressing our emotional needs first? There are a few reasons for this. One is that we have a primal drive to engage in sexual activity. Our brains are wired to seek opportunities for sex, even though our brains are also wired to seek relief from emotional or physical distress. Sex is one way men seek relief. When we engage in sexual activity, the brain releases neurochemicals like dopamine and oxytocin that cause us to experience pleasure. Sex is a great way to soothe when the brain is able to turn off the distress alarms. During delayed or inhibited ejaculation, it's as if the brain is trying to address two primary drives simultaneously: the drive for sex and the drive for survival. Ejaculation is important to a man as well as his partner. It is one signal of the completion of the sexual session. This is why some partners believe they have failed if their male lover doesn't come. They conclude that they're not a good lover, that he's not really attracted to them. Women often conclude that he's cheating or he doesn't love her anymore if he has trouble getting an erection or ejaculating in her vagina. These wrong conclusions only make a man more anxious because not only is he dealing with his own sexual frustration, he also has to worry about his partner's feelings, their self-esteem, and the accusations if he doesn't deliver the goods. It can become a perpetual cycle where anxiety escalates every time he attempts sex. And sadly, some men will avoid sex entirely so they don't have to deal with the pressure. Ejaculation is also important for those couples who are trying to get pregnant. The pressure to perform often while she is fertile can impair some men's ability to achieve an erection or ejaculate. Sex feels like a performance where he will be judged as a failure if he doesn't deliver in a way that achieves the goal. Fluid bonding is a concept you've heard me mention previously. The deposit of semen into another person is an act of intimacy. Receiving a man's semen can be like receiving a rose on the reality show The Bachelor. Some partners experience this as acceptance, approval, love, or desirability when their man deposits his load into or onto them. The average volume of semen a man deposits when he ejaculates is about 1 teaspoon. The volume of semen a man produces generally decreases with age. By the way, semen isn't just made up of sperm. It has a lot of ingredients, including water, proteins, vitamins, minerals, hormones, and carbohydrates. We project a lot of meaning onto that one little teaspoon of jizz, and when he doesn't produce it, conflict sometimes ensues. A man might experience ejaculation as a loss of control since orgasms do release neurochemicals in the brain, like dopamine and oxytocin, that influence the experience of trust and bonding with another person. Some men find this causes them to feel too vulnerable emotionally. They resist letting go to avoid the emotions that might follow. Men have described ejaculation with a partner as if it is their signature on the dotted line. If it means too much to the other person, there might be more expectations of him to follow. He isn't necessarily avoiding the ejaculation, but the potential consequences, obligation, or expectations that come afterward. When a man is alone with himself, he doesn't have to worry about anyone else. He can enjoy a solo sexual experience without concern for what a partner might project onto him or the relationship. Masturbation includes biofeedback. He knows exactly how much pressure, friction, lubricant, visual or auditory stimulation is needed to bring him to climax. He doesn't have to depend on anyone else to get it right. He doesn't have to perform for anyone if performing isn't what he's into. He doesn't have to feel responsible for anyone else's thoughts or emotions during the solo session. This is why many men describe masturbation as their me time. Here are some things I recommend for men who experience delayed or inhibited ejaculation when with a partner. Number 1, Consider everything I just told you. I know it was a lot of information. Men are very quick to deny that there can be anything psychologically impairing their sexual function. Make a list of the thoughts that go through your mind when your body isn't cooperating in a way that you and your partner desire for sexual gratification. Then, list the emotions associated with those thoughts. Ask yourself what you are afraid will happen if you're not able to perform as expected. Number 2, identify one consistent partner you can practice with. Building familiarity with another person will help you ultimately relax. It needs to be someone you trust. A screaming, crying, accusing, judging, shaming partner is not a good person to practice with. You might think that sounds amusing, but quite often men tell me this is exactly what they get when they can't perform to the partner's expectation. Verbal and emotional abuse isn't sexy, and it will only increase the symptoms. Number 3, don't make intercourse the focus of your sexual experience with the other person. You've heard me say many times that most people don't think they're having sex unless there is a penis penetrating an anus or a vagina. I know that is likely what you want, but learn to simply be with the other person, enjoying each other's body. Imagine sexual sessions that last an hour with lots of foreplay. Touch causes the brain to release those natural neurochemicals that relax the body and the mind. When you allow parts of your body other than your penis to experience tactile sensations, you will find that your erotic experience is more pleasurable. Number 4, remove the visual cues. Sex also relies on olfactory, taste, and auditory sensations. I sometimes have my coupled clients blindfold each other during sex. This forces them to rely on other senses. During sex, we might be looking for visual cues from the other person that help us assess if they're having a good time. Even the tiniest micro-expression can trigger self-doubt and anxiety. Number 5, do what works. If taking matters into your own hands will help you reach a climax, then don't hesitate to masturbate in the other person's presence. Masturbation is a way to use the biofeedback we experience to train our brains to relax enough to let go while someone else is present and watching. This is likely easier for gay men than straight men. So many of the straight couples I've worked with have never seen their partner masturbate, and the number one reason they give is that it would be too embarrassing. If self-pleasure embarrasses you, then you definitely have some shame to work through regarding your sexuality, and that shame is likely a factor inhibiting your ability to ejaculate. Number 6, don't hide it. Tell your partner that you don't always come during sex and that you're absolutely okay with that, because it doesn't mean that you're not having a good time. Hiding anything takes a lot of energy. If your brain is focused on trying to keep a secret, then you will not be able to relax and enjoy yourself. Remove the secret. When you're not trying to hide it, your brain can stop trying to control it. You have removed the pressure, and ironically, surrendering control will increase your chances of getting off. This is often the paradoxical solution, and it's why I so often advise you to just be yourself. Never succumb to pressure to do anything that you don't want to do or anything that you know you can't do. Number 7, get a consultation. Hire a sex therapist or sex coach to help you explore the dynamics as they are unique to you. Not all therapists or coaches are trained in sexology, so you need to hire someone who is sex positive and has experience treating sexual dysfunction. The American Association of Sexuality Educators, Counselors, and Therapists has a directory of certified providers on their website at asect.org. That is AASECT.org. I'm Dr. Stephen Davidson, the Sexual Integrity Coach. I hope you will like this video and subscribe to this channel for weekly sex education videos. Please visit my website at sexualintegritycoach.com. There you'll find information about the coaching services I provide, as well as links to my books that are available on Amazon, Audible, Kindle, and bookstores near you. Those books include Peaceful Mind, Peaceful Life, the Guidebook to Happiness, as well as Sexual Integrity, Finding the Courage to Be Yourself.